Hi everyone. Today I will be talking about a very important subject, and that is diabetes mellitus type 2. We will learn about how we can prevent type 2 diabetes and what is pre-diabetes, and generally type 2 diabetes is commonly called as diabetes. The common symptoms a person comes up with is excessive urination, that is increased frequency of urination. They have to go again and again to the bathroom, to the washroom and pee. Many a times 2 to 3 times at night, and it is increased than before. They can have symptoms of excessive hunger, बहुत ज़्यादा भूख लगती है, or excessive thirst as well, because they feel a lot of dryness in the body, and a lot of fatigue. That means tiredness, extremely tired even with doing very little work. These are the common symptoms. When a patient presents with it, we generally advise that you must take up a test to test your blood sugar levels. Here I would advise everyone who is in the age group of 40 and 40 plus to get their blood sugar levels checked yearly, because generally a lot of people present with high blood sugars in that age group. It doesn't mean that less than 40 people do not suffer, they do. If you have any of the symptoms that I've mentioned before, you must consult your doctor and get yourself tested. Okay. Now, the basic test that we generally advise our patients is fasting blood glucose levels, wherein the patient is asked to be fasting for 8 to 12 hours, and then they get themselves checked for their fasting blood sugar levels. There is the OGTT test, that is the oral glucose tolerance test, and post lunch blood sugar levels. And we do one more test, which is the Hb A1c, which gives an average of blood sugar levels in the last 3 months, right? So these are the basic tests that we go forward with. Now, fasting blood sugar levels, if they are in the range of 100 milligram per deciliter, it means you're in the normal range. Okay. If the range goes beyond 100 milligrams per deciliter to 126, okay, if it's in between 100 to 126 milligram per deciliter, it means you're a pre-diabetic. And if it is above 126 milligram per deciliter, it means that the person is suffering from diabetes. Okay, we label them as diabetes. Post lunch blood sugar levels, or the OGTT, here the levels, if they are within 140 milligram per deciliter, it means it's the normal range. If it is somewhere between 140 to 200 milligram per deciliter, it means the person is pre-diabetic. And if it goes above 200 milligram per deciliter, the post-lunch blood sugar levels, it means the person is labeled as diabetic. Okay. And the very important test, Hb A1c, which gives an average of 3 months. Here, if your if your level is less than 5.7%, it's in the normal range. If it is between 5.7% to 6.4%, it is termed as pre-diabetes, and above 6.4 is termed as diabetic. Now, what is pre-diabetes actually mean? Pre-diabetes means that a person has high blood sugar levels, but not high enough to constitute them as diabetes. So they are high but not as high enough to label them as diabetic. And 1 in 10 adults today is suffering from pre-diabetes. And the good news here is that if you change your lifestyle, a healthy lifestyle can actually help you get to the normal range of blood sugar levels. Okay. And also, people suffering from diabetes, they can manage their blood sugar levels really well with medication and a healthy lifestyle. A healthy lifestyle is extremely important. Now I will share with you 3 important things that you can do to prevent diabetes. If you're a pre-diabetic, also it will help you in getting back to normal blood sugar levels, and Also, if you're suffering from diabetes and taking medication, healthy lifestyle is important to maintain your blood sugars at normal. Okay, so the first and foremost tip that I'd like to share with you is about clean eating. Try and eat as much as home cooked meals as possible. Avoid packaged foods completely. So, no chips, no sodas, no butter, no cheese. Eliminate that from your diet and try and eat more of fruits and vegetables and plant based foods that can help you keep your blood sugar levels to normal. Also, try and maintain your meal timings. Eat at regular intervals. It will go in a long way in helping you maintain your blood sugar levels and also keeping you energetic, right? Eat a balanced meal of carbohydrate, protein, and fat. Okay, include the good sources, the plant-based sources as much as possible in your diet and see that how your blood sugar levels get back to normal. Definitely consult your nutritionist and your health physician or a diabetologist before you take on any diet. Okay, because here when a patient comes to us, we take into consideration the patient's lifestyle in terms of their daily routine, their eating habits, and then advise as per their temperament the right kind of exercise and diet. Okay, so very important thing that you can do is start avoiding all processed foods as much as possible and eat home cooked meals. Second important tip is to exercise. Exercise regularly, at least 5 to 6 times a week for 30 to 40 minutes. It could be brisk walking, jogging, playing a sport that you enjoy, badminton or squash, or you can go for cycling or functional training, whatever you like. But please pick up some form of exercise on a regular basis, right? And last but not the least, do practice meditation and yoga, because stress is one of the main reasons why a person generally suffers from high blood sugar levels. We've had patients with a very healthy lifestyle wherein they do their exercise regularly, they eat very clean, but yet, when they are tested, their sugars are high. The reason is because they are stressed. Here I can recall a patient who had, been living a very clean life, but she was very stressed because of some property issues at her place, and that's the reason why she always had high blood sugar levels. And then, with the help of counseling and homeopathic medicine, we could, kind of get her back to normal blood sugar levels. So stress is one of the key reasons why your sugars can go high. It could be even financial stress, any form of stress, okay, relationship stress, any form of stress that could lead to high blood sugar levels. And here meditation can really help. You can do guided meditations that are available, online, or you can practice chanting, or you can spend some time in nature, whatever suits you. Do deep breathing. Yoga is again very healing, and this is what I advise all of my patients: to eat clean, exercise at least 5 to 6 times a week, and also meditate. So diabetes mellitus is a very vast topic, but I have tried to cover as much as I can in this particular video. If you would like to know more, please write back to us. We will make another video on it. And do share this information with your friends and family and spread awareness on this World Diabetes Day. And I'm Dr. Komal Gandhi, consulting homeopath, consulting nutritionist, and I will see you soon next week with another health video. Thank you.